Hello, my name is Rebecca Smith, Managing Director of Safe Hands, and welcome to the Safe Hands podcast. It's officially winter here in Dubai, and for a lot of people that means good weather, lots of outdoor activities, festive celebrations, and planning for the new year. However, as well as all of the fun things that this time of year can bring, it also brings with it some challenges. This period tends to be quite a hectic one, whether you're running around trying to tie up your loose ends for the end of the year, or you're running around trying to start your new year with a bang. We tend not to be the only things running. And I am in fact referring to the dreaded runny nose. We see it a lot this time of year. Do you like what I did there?
Yeah.
Do you like what I did there?
Very well done.
In today's episode, we're going to be talking about seasonal viruses in children. We'll be discussing the different types of viruses that affect little ones, such as influenza and RSV, and the remedies or treatments for these, as well as preventative measures you can take. My guests today have some really specific expertise in these areas, and I'm excited to have them on the podcast today. First up, I am joined by Dr. Rania. Hello, Dr. Rania.
Hello.
Specialist paediatrician and owner of Circle Care Clinic here in Dubai. It's great to have you on the episode today.
It's great being here. Thanks
I
for
think we've got
inviting me.
the right person for the job when it comes to the runny nose. You probably see a lot of them this time of year.
Definitely.
We'll chat more about that in a second. I'll introduce our second guest first of all. And our second guest is fellow Safe Hands nurse, Laura Russell.
Hi, how you doing?
Mum of two as well, so you can probably relate to a lot of the content that we're going to be discussing today.
Yes, unfortunately I can. But
Unfortunately.
yes, definitely.
Well, thank you guys for joining us today.
Thanks.
So it's probably good that we start from the beginning. Laura, I know you've been on a podcast before. Our listeners may be familiar with you, but Dr. Rani, your first time.
Yes.
So can we start by just giving our listeners an overview of your background? Just give us a little intro.
Right. So I'm Rania. I'm a pediatrician, and I've been a pediatrician in Dubai for the last 9 years. I actually grew up here. So Dubai's home, and lived in London for 10, 15 years, and moved back.
Okay.
And I studied medicine in London, pediatrics being my speciality. And at the moment, as you rightly said, I should say runny nose being my speciality. But we do see a lot of allergies. So, I touch on that especially in connection with infections. I do a lot of gastroesophageal reflux, anything in children from 0 to 18 years old, basically.
Okay.
And I'm just about to launch my own clinic, which is very exciting.
Congratulations.
It's been hard work, but we hopefully should be open very soon. Circle Care Clinic.
Good for our listeners to know. You may get a few visitors on the back of the podcast today. I'm sure lots of people are going to be able to relate to the content. So let's start from the beginning in terms of our topic. We mentioned seasonal viruses. From your experience, what are the different types of viruses that you tend to see the most of at this time of the year when it comes to little ones?
Right. So the most common virus is the common cold. Right. So these are viruses, nameless, to be honest, the majority of them, which cause what you said, the runny nose. The runny nose, the cough, mainly the cough from postnasal drip, which is your nose running backwards when you lie down, which is why many of us, I'm sure Laura, if you see this, your children have a runny nose during the day and they cough the minute they put their head on the pillow.
Yeah.
Yes. So these viruses that basically, they're respiratory viruses. So they cause a blocked nose, they cause coughing, sore throat, fever, and all those symptoms. And then you mentioned two major ones, influenza and RSV. Yeah. They're worth mentioning and worth giving a name because they do cause lots of complications, and because you can prevent them with specific vaccines should you need to, and you can treat one of them, namely influenza, if you were to diagnose it, because it is so highly contagious.
Okay.
But the majority are respiratory viruses, and of course there are also the tummy bugs, the stomach viruses, vomiting, diarrhea, those. Yeah.
Okay.
Yeah.
And what are the signs and symptoms of the most common viruses that you see? How can we identify them?
Yeah, so very often starts with the sniffles, a runny nose, a cough that's related to that, sometimes dry, but often phlegmy or wet, rattly, and very often I'll have parents bring in their children being convinced they've got a chest infection because they've got this rattle or phlegm in their chest, and sometimes it's all in the upper airway. Child might be tired, might be refuse to eat because they have a sore throat, and you find their activity levels drop. They might go back to having naps when they'd stopped their naps, and then very often the way you catch it is if you're a mum and you're on the WhatsApp groups and then at school, which a lot of us are. You basically, it's like a domino effect. One's off, then the others are off, and the others off, and the others off, and they're highly contagious. So back to the runny nose. So that's your first symptom usually. But sometimes it's a headache as well, by the way.
Headache
sometimes,
as well. You mentioned the fact that they're highly contagious. We were talking before the podcast, and I think the stat that you mentioned is worth noting. It's the influenza stat. Hit us with that stat.
Right. Okay. So this is about influenza A. So this is where people get scared of the title swine flu or bird flu being two of the influenza A's. So there is a stat saying that if there are 20 people in a room with a closed door, so they're sharing that air for half an hour, and one of them has influenza, when they leave the room, there will be 17 of the 20 with influenza A.
Crazy. So I didn't know that. Did you, Laura?
No, I didn't. But I did understand the importance of when your children are sick to keep them home. Because it is that cycle that just continues to go.
Exactly.
And it doesn't end.
It doesn't end.
I mean, I can't vouch personally.
Anyway. You guys know. Well, you know from your experience from home life. You've got kids yourself, little ones.
Exactly.
But do you feel like Dubai as a place, we tend to see an influx in sort of these sorts of viruses in comparison? You spent a lot of time in the UK, Dr. Rania. Do you see a difference in terms of the influx of these seasonal viruses?
Interestingly, more here in a way, because we're very transient population, so people travel in and out, and I think for a big proportion of the year we spend a lot of time indoors. So our children, I'll talk about mainly children who that renowned for being the sector of the population that spread these viruses around the most. They spend a lot of time indoors in their nurseries, at schools, and in each other's faces. I mean, you've got kids. I've got a 3-year-old, and so this concept of hand hygiene and stuff. It's great to teach them, but it doesn't really happen. So they share toys, they put them in their mouth. So ultimately, I think our children here spend more time indoors, sharing toys, as opposed to being outdoors playing with, garden, sort of garden toys and things. Where if you've got the wind and the sun, those can, like the sun, especially sunlight, can sterilize certain surfaces. But on the inside, as clean as you can get, you can't keep up with it. And the other thing, I think you touched on it, Laura, where because we're a working population, it's sometimes difficult for a working parent to have their child stay at home just because they have a runny nose. So I think we're in a situation where, for necessity, some of us do end up sending our kids to school. They don't yet have a fever, but they're contagious. The runny nose, it's any secretion your body releases. It still sounds disgusting. You have a runny nose or diarrhea. Anything that leaves your body in fluid form is how you pass a virus on. So if your child has that symptom, the fever alone isn't enough of a restriction in terms of, so if they don't have a fever, they can still pass it on, and they end up going to school. So I think that's why it propagates. Similarly with us, where we work. So if you work, unless you're dying and can't get out of bed, you go to work. Because also I think there's sort of certain restrictions or feelings of obligation here with work that may not be the same if you lived elsewhere. With sick leave and things. And it's just it's a culture thing. It's
That's it. We've got probably 4 people I can name in the office at the moment sat there with the dreaded runny nose, amongst other symptoms.
Another 4 that probably should be at home.
I know. And I think psychologically, I'm like, is my throat hurting today? Do I feel ill? Do I have a temperature? But people are still sat at their desks, and it is that culture, isn't it? And you guys are working mums yourself. You know how hard it can be to arrange childcare. So I guess, you're right. There probably is that expectation.
And doctors are not allowed to be sick ever.
No.
Did you not know that?
You're
just not allowed to be sick.
My mum was a nurse, and I remember being taken to school many times, feeling very, very ill. But it was like,
just go. You'll be fine.
You'll be fine. This is nothing. But in terms of sort of sending your children to school when they're ill, and looking at the concept of immunity, is there some benefit to them getting a common cold in younger age ranges, as opposed to being too restrictive with their interaction when people may be slightly ill?
100%. So this is where the hygiene theory comes in, for instance. So yes, these viruses mutate and change. So the way our little lesson, the way our bodies react to viruses, you catch a virus and think of Lego structures. Your body sends out little sort of antibodies or cells that learn the shape of that particular virus, and then they multiply, so that if that same virus comes back, those antibodies plug onto it and get rid of it. If the virus changes shape, your body has to relearn that and produce another army of antibodies. So if you're exposed to enough viruses, and viruses are all slightly related to each other, your child ends up at an age where they're able to recognize most viruses at the outset and not get the symptoms. So just because you don't get the symptoms doesn't mean you're not fighting the virus. It's sometimes when you lose the fight is when you get the symptoms, and then you eventually do get rid of the virus. So in essence, not protecting your child as much as other people think you should when they're younger is a good thing. Because once they do it does build their immunity.
So it's that fine line, finding that balance, I suppose, which I imagine is quite difficult as a mum.
It is. It is.
And you can clean the toys and change the toothbrushes as much as you want. It's still at the same time. It's just a matter of it's going to happen.
I know.
Yes.
Play areas. That's my pet peeve in Dubai.
You
go to a play area in the middle of the week, and the children there are the children who have not been sent to school because they have runny noses. Do not take your child to play area in the middle of the week.
Just key point from the podcast. No play areas.
Sorry, play areas.
I've never even thought of that.
They try to keep them clean, but what do you do if you're a working parent and your child is okay but not allowed to be at school because they've had a fever in the last... My son had a 38 fever yesterday, but woke up with no fever this morning. And I could have sent him to school, but I stuck to the rules. I didn't send him to a play area, but I could have. He was well enough. No, I didn't. No,
So key point there. No play areas when they're sick for sure.
Very good point.
It is a good point actually. Like I say, something for you to take away as a mum there, Laura. But in general, are there any preventative measures we can take, or are there any home remedies that we can give little ones? And when do we require that visit to a doctor?
Yeah, it's a very good question. So preventive measures, hand hygiene, I think is very important. Teaching your child how to cough or how to get rid of a tissue if they do blow their nose. So the simple things of coughing into your elbow, of getting rid of that tissue, using sanitizer gel. It's everywhere in schools, wherever you go. If they use hand sanitizer, even if it's not that easy to wash. Teaching them not to put toys in their mouth teaching them not to share food with their friends just because, well, we do that with allergy risks anyway, but teaching them just again so that you don't pass viruses. Having a good healthy diet. So supplements, many people ask me about supplements, and there is a room for supplements somewhere, but if you have a healthy diet where they have their, fruit and veg as they should, and your vitamins are being ingested from fresh food, then you don't necessarily need supplements. But there are some studies that show that if you take vitamin C during viral period, that can boost your immunity slightly. They're not that strong. Manuka honey is another one. That's probably one of the very few supplements that has been proven to have very good antiseptic and immunity boosting techniques. So that's one you can adopt.
Okay.
And there are other ones. So I think it's just common sense. Hygiene and a healthy diet is probably the best thing you can do at home. Once they have a virus, home remedies to help with the symptoms. There's nothing better than honey for sore throats. There are these cough syrups, herbal cough syrups, and they're okay, but they are they're sugary. Some of them actually make your children bounce off the walls.
Which is the last thing you need right in that situation for sure.
So and chicken soup. I know it sounds very old-fashioned, but it's the warm fluids. That's what that is. And if you put stuff in your stock like onions, whatever, all of that's meant to have antiseptic properties. So a virus at the end of the day has a life cycle of 7 days. So from the day you catch, except influenza, which can last 2 weeks, but any other virus lasts 7 days. So and then you get a peak around day 3, day 4 with the cough and the fever, and then it gets better. So you look after, it's TLC during that time. Treat the temperature if you have to, give them, foods they're happy to eat, keep them well hydrated and keep them well rested until they get over it. There's nothing you can give them to speed up the recovery.
Just a hug.
A mum cuddle.
TLC. Yes, exactly. And that's and avoid breathing in their face so you don't catch it. But and then prevention. So this is where we talk about vaccines.
Yes, I was going to come on to that.
You mentioned it, preventing. But so influenza, because it's influenza season, we talk a lot about the influenza vaccine, and it is extremely effective. Keeping that stat in mind I gave you about influenza A specifically, influenza B is not as bad, but almost as bad. The vaccine changes every year based on the viruses that are around prior to the season starting. So a new vaccine is made every year, which always has the most common strains. you're likely to be exposed to. And it's different in different parts of the world depending on which strains are more are more prevalent there. And it may not stop you catching the rarer influenza viruses that have not been put in the vaccine, but it protects you against 90 to 95% of the ones you're likely to be exposed to.
Yes, good percentage.
It's a very good percentage. And even if you are if you or your child are healthy and fit and prefer not to have vaccines or not to take extra vaccines or extra medications, it's the other ones around you who, because it's so highly contagious, I was talking to someone for the podcast and mentioned his child is still feeling very tired 2 weeks after influenza. And that's typical. The virus is gone, but the fatigue that remains affects, everything, activity levels. And to be honest, if you don't treat influenza or if you don't prevent it, your body excretes it for 2 weeks after you've caught it. So you're even if you feel well, people around you can still catch it.
Right.
So one of the reasons to vaccinate is prevent the spread.
Yeah.
Not just for you, but for others.
Yeah.
RSV is the other virus you mentioned, which causes something called bronchiolitis. So any parents of young children who've had the virus go to their chest and cause a rattly cough, and some people need nebulizers, and it's just a whole other sort of discussion. But basically, it's a virus that leaves the part of the airway, which is nose and throat, and goes to the chest and causes almost a viral chest infection or viral pneumonia. That one, there is a vaccine for, but it's an extremely expensive vaccine, and it's not necessary unless the child is a premature baby who was born early and had some lung issues. So it's sort of reserved and not recommended for others because you can get over bronchiolitis the older you get. So if people have heard of the RSV vaccine, that isn't one that we would recommend for everyone.
Okay,
and
so
it's unnecessary.
It's not standard.
Yeah, but just because we mentioned those two viruses, there is a prevention.
Okay.
But influenza is the one I would say everyone should get influenza.
Okay.
First on the list are babies from 6 months old and pregnant women.
Okay.
Yeah, hi.
And is there anyone that you'd recommend get the vaccine if there are certain risk factors involved? I know you mentioned certain age ranges there, but anyone with sort of existing conditions, or is there anyone outside of sort of babies and, like you said, pregnant women?
Yeah. So for influenza vaccine, everyone. But
everyone ideally.
Everyone. But namely people with allergies or allergic diseases. So people with asthma.
Okay.
Or people with allergic rhinitis. Or because if you have a condition which triggers airway tightness or airway hyperreactivity, and you get a respiratory virus on top of that that complicates everything, you're more likely to have complications that end up with the proper bacterial pneumonia that then needs antibiotics or hospital admissions or an oxygen dependency or. So if you have something that makes you more vulnerable, then there's more of a need for protection.
Okay.
So those people specifically, and interestingly in Dubai we see bigger numbers of people who fit under that seasonal allergy or stroke asthma umbrella than you'd imagine.
Why do you think that is? Just out of curiosity, I'm sort of veering here.
Yeah, I mean, we live in two different environments. We live in an indoor environment and an outdoor environment, and during the year, the outdoor environment's very different. You have half of the year where it's hot and humid and sticky, and the other half where it's more dusty. Yeah. So there is a lot of construction, dust everywhere. We live in the desert, essentially. Some of us live in parts of reclaimed land into the sea, where it gets more humid, like me and you, Laura. We live on the pond, so you end up with more humidity and mold in your air conditioning. So we end up breathing in more dust mites and more mold spores here than we would in other parts of the world. Okay. And because we're more indoors, we're depending on that air conditioned environment. Whereas in other parts of the world where you'd imagine, it's colder, you might get more sick. Interestingly, you're spending more time outdoors, where your airways, and the difference between indoors and outdoors in other parts of the world isn't as different as here. So our airways have to adjust to the sudden dryness you might get when you're indoors, and to do that your airway produces more mucus in order to lubricate it, and then you go outdoors and it's humid again, and then it has to do the opposite. So it makes sense that we capture more allergens, and maybe then that we're not sure, but maybe then that is more triggers allergic symptoms in more people, because the factors are more basically.
Do you think also because of the amount of people travel that these factors that is so high
in terms of the viruses and
comes through?
No, you're absolutely right. Yeah, so because there are more viruses, and viruses are more likely to show up people who do have the allergic symptoms. So if you catch more viruses, you will then you'll be picked up as the more allergic one. Whereas if you don't have the virus, which is the trigger. So children, for instance, childhood asthma, used to be known as a viral-induced wheeze. Before we used to call it childhood asthma. So it would be a child would catch a virus and then wheeze. And we used to avoid the label of asthma. Now we say childhood asthma is an illness that most children outgrow and is triggered by a virus usually. So it's not, so you know that cliche image we have of someone going into a dusty room and getting an asthma attack. Children tend to not do that. Children tend to catch a virus, and if they have the genetics to you know, the innate presence of this, exactly. Then they get that very prolonged cough, a wheeze.
Okay, interesting. I've learned some stuff there.
Interesting.
We talked about briefly there the signs and symptoms of the different viruses that you see most often. How can parents identify whether or not they need to see a doctor? What sort of signs and symptoms would they be looking for that would trigger that visit to see a pediatrician?
So it's different with different ages. So if you have a very young baby, an infant, and especially if it's an infant in the first 3 months of life, a fever that lasts more than 48 hours that's difficult to manage, I would say, regardless of any other symptoms, should trigger a visit to a doctor. And if it's your first baby, maybe even sooner. Because it could be a sign of a bacterial infection, which is dangerous for babies that young. Once they go over the 3-month mark, and it's not a magic red line or something, but they tend to be able to deal with bacterial infections better, and you can then tease away, it's a runny nose and a bit of a temperature, and if you do need to use a paracetamol or any sort of fever reducer, and you do, then your baby seems fine and feeds okay. So you can tell it's a cold. So, but if a temperature remains high and lasts more than 4 to 5 days, which is the upper limit for most viruses, then you should see a doctor. If the fever goes away but then comes back 2 days later, you should see your doctor. If the fever pattern gets worse and worse as you go along and past day 4, and your child has other symptoms like they're clutching their ear, or they've got a very wet cough, or they completely go off their food, or they're just very cranky, you should see your doctor, because there could be a secondary bacterial infection. And with the viruses that go to the chest, like bronchiolitis, if your child is fine fever-wise and cough-wise but has breathing difficulty, so much so that a baby can't suck on their bottle or feed properly or complete a sentence if they're a bit older, then you should see your doctor for that supportive treatment, which is like more the asthma type treatments.
Good guidelines there. I think we obviously train a lot of parents, don't we, on a day-to-day basis. Probably you more so than me now, Laura, but I know it's a little confusing area for parents in terms of fevers. What constitutes a fever? When should you see a doctor? So I think that's really good in terms of clarification there. When to take that step for sure.
Definitely.
I'm going to wrap it up with one last question. What do you hope the listeners are going to take away from the podcast today, Dr. Rania?
Get your flu vaccine.
Get your flu vaccine.
Well said.
No, that a virus is self-limiting. So I can say flu vaccine till the cows come home, but ultimately the most common virus is the common cold. It will go away in 7 days. So hang in there if your child is doing all the things they're meant to be doing to 50 to 75% that capacity when it comes to eating or being happy or having the energy, or if they're able to do all the things they do regularly, then they're okay. Don't look at the numbers, look at your child. Children are so honest. If they're tired, they're tired. If they can't eat, they won't eat. If they're in pain, they'll tell you. So I think look at your child, not the numbers, not the stats, not the neighbors, not the friends. So I would say that don't jump and get antibiotics. Don't, just hold fast. And if it's a runny nose, if it's diarrhea, if it's a cough, it's a virus unless proven otherwise.
And have you got the flu vaccine? Have you had the flu vaccine? Just out of
interest.
Yes,
of course.
Have you had it, Laura?
No.
I have. No. Little ones had it?
No, they haven't, but they will be next week.
I think you've got something to take away from the podcast in terms of immediate action. Flu vaccine, but it's been super informative. Thank you so much, Dr. Rani. I've learned some stuff, and I'm sure the listeners will as well.
Thank you for having me.
So thank you so much to the both of you for joining on the podcast today. It's been great having you.
Thanks for having us.
No problem. Anytime. Anytime. So like I say, thank you to our guests, and also thank you to our listeners. If you've tuned in today and you found the episode valuable in terms of the information that's been provided, let us know. Give us a like, give us a share, leave a comment, or drop us an email at info@safehandsuae.com. And as always, stay tuned for the next episode.